Have you ever thought of, if I'm involved in a sexual assault or rape, what should I do? Or have you ever thought of, if I'm involved in an unprotected sex, what should I do? On today's edition of Know Your Health, we want to quickly enlighten and educate us on what you should do whenever you encounter or find yourself in this kind of situation. If this is your first time on coming across my channel, please do well to subscribe, put on your notification button on so that you don't miss out. Then first of all, what is an unprotected sex? An unprotected sex is a sex without a contraceptive or condom. You may have used a condom but it slipped off or got broken along the line. Then the big question now is what should I do in this kind of situation? Here are two things that you are very much interested when it comes to sexual assault or rape or unprotected sex, which are pregnancy and sexually transmitted diseases. In the case of pregnancy, you have to quickly get an emergency contraceptive such as post-pill, post-no2 or plan B pill as the case may be. You can get this in any pharmacy or chemist around you. And it is pertinent to know that this emergency contraceptive works with time. As the hours increases, the efficacy decreases. There are some other minor side effects you can as well experience if you take this emergency contraceptive, such as headache, nausea, vomiting, and bleeding, as the case may be. Another important thing in the case of pregnancy is getting an IUD. An IUD is an intrauterine device that is inserted up to 5 days of encountering or experiencing a sexual assault or unprotected sex. An IUD is one of the best contraceptives that women normally use to prevent pregnancy. It's a T-shaped rubber that is placed on the uterus to prevent ovulation. Studies have shown that IUD is 99% effective in the case of preventing pregnancy, and it has the capacity to prevent pregnancy up to 5 years. There are some contraindications to using an IUD. Before using an IUD, you have to run a thorough checkup of yourself to establish that you are not pregnant, you don't have any infection or history of bleeding or malignancy. This is a very good step you should take to avoid these complications. It's advisable that you run a pregnancy test after 2 to 3 weeks of encountering or experiencing a sexual assault or rape or unprotected sex. If you run it immediately, the human chorionic gonadotropin hormone that is normally detected in urine or blood may not be enough at that particular time, and you might get a false result. The second thing that we are very much concerned about when it comes to sexual assault or rape or unprotected sex is sexually transmitted diseases. How do you prevent sexually transmitted diseases in this kind of situation? In the case of women, the first thing you should do is to pee immediately. Take a lot of water to help flush out any infection in your private part. Then take a shower and wash up yourself. Washing up yourself here does not involve touching your vagina. That is sweating liquid into your vagina to help wash out any infection. But the thing you should do here is to wash your vulva with warm water, then book an appointment with your doctor. It is important to know that some of these infections are treatable or cured, such as chlamydia, trichomoniasis, gonorrhea, while some other ones are not treatable. They can only be managed, such as hepatitis, human papilloma virus, HIV, as the case may be. Then when you book an appointment with your doctor, you can recommend some tests for you to run, such as vaginal swab, urine analysis, and a blood analysis. Though some of these infections does not manifest their symptoms immediately, it takes a while before they start manifesting their symptoms. That means you can schedule with your doctor in a month's time or in a 2 months' time when you start experiencing some symptoms to come and take up or run this test. Then in case of HIV, if you suspect that your partner has HIV, your doctor can recommend post-exposure prophylaxis for you to help build your immune system against any viral infection. If this is your first time of coming across my channel, please do well to subscribe. Put your notification button on so that you don't miss out any important information when a new video is being published.